Good evening, everyone, and welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James. Happy New Year. Tonight, we're talking to Dr. Dionne Middlebrooks, and she is going to talk to us a little bit about perimenopause and menopause, as we deal with aging adults. There are certain changes that happen as we get older, and we're going to talk a little bit about each one of those tonight. But let me tell you a little bit about how I met Dr. Dionne. I was following her on LinkedIn for a long time. I feel like it was over the pandemic. And I was watching all of her posts about different comments that I actually felt resonated with me. And they were educational, but also provocative in some ways in terms of entrepreneurship and being a physical therapist in general. So tonight, and then I met you in person at the American Academy of Physical Therapy conference last year. And so everything kind of came full circle. And we actually talked about this topic, and I wanted to be able to share that information with you tonight. So if you're listening, join us and engage. So if you have a question, please put it in the comment section and we'll answer it. And then if you want to give us a comment, you can put that in the comment section as well if something we say resonates with you. And as always, Pull Up with Limbs and Things is to confirm something you know, to challenge something you don't know, and to give you the opportunity to share that information with someone else. Welcome, Dr. Dionne. How you doing?
Hey, thank you so much for having me. Happy New Year to you and everyone joining. Yes, thank you for having me.
Yeah, so tell us a little bit about, let's jump right in. Tell us a little bit about perimenopause. Let's talk about that one first. What is it and all the facts?
Yes, so perimenopause in simple terms is the bridge to get to menopause. And perimenopause itself can begin around the age of 35. So usually mid-late 30s, women can start going through the perimenopausal transition. But it's something that is generally a gradual-based transition. And this can occur between the ages of 35 to 45. So some women may not even start until their mid-40s. So if you're someone who's in their 30s experiencing perimenopause compared to someone in their 40s, just know that you're still within that average range that we typically see. But yeah, it's something that naturally occurs. And I want to emphasize that because whenever we hear perimenopause and menopause, we all freak out, but it is a natural transition. It's something that we need to kind of, in my opinion, reframe our thought process here in the US, because we tend to associate it with negative concepts when we can look for more of the positive things. Now, I understand some of the symptoms that people have with it are not always positive, but there's more things that we can do to try to help improve those things as well. So yeah, perimenopause, the transition, that bridge in order to get to menopause. And menopause is when your period itself is actually stopping. So you have not had your period for 12 consecutive months. And that can occur because of surgical-based intervention. So yes, if you have a hysterectomy, you are going through menopause because they have removed the uterus. And then also it can occur naturally as well, where gradually over time, the gonads stop producing certain levels of estrogen, and then you end up with various hormonal changes that lead to menopause.
Right. So let's talk menopause specifically. What's that?
Yes. So menopause, like I mentioned, is that true moment in time where you have not had any menstruation for at least 12 months. Menopause, however, can be abrupt with surgical intervention. So if you're someone who's had a hysterectomy, you have officially entered into menopause. Even if they leave the ovaries, now because you have impacted the ovarian and the uterine-based connection, you still would enter menopause immediately with surgical-based intervention. Now, naturally, 12 months without a period, Now you've at menopause, you have gone through menopause pretty much immediately. Now you are post-menopausal. So even if you get to month 11 and all of a sudden month 11, your cycle pops up, I'm sorry, you have not officially gone through menopause yet. The entire calendar starts over. So now you're counting starting with month 1 all over again, just to see how long you go without that period. So yeah, so cessation of your menstrual cycle for 12 months for more of natural-based menopause compared to that of surgical menopause, which is an immediate removal of the uterus, which results in that immediate abrupt change.
Gotcha. Okay. So we talked about perimenopause and menopause. There's one that is specific for men. It's called andropause. Can you talk to us a little bit about that?
So with andropause itself, this is where we start noticing the changes in more specifically the male hormones, which is related to testosterone, and it does decrease. Now, some of the changes that women go through are much earlier compared to men. Women, we start noticing changes in our 30s. Men start noticing certain changes more so in their early mid 50s. So there is that imbalance as well. And generally speaking, with the changes with testosterone, they start having decrease in muscle mass. They start having decrease sometimes in libido. It can be a common time for erectile dysfunction to occur as well. So those are some common symptoms with andropause. Also with andropause, it is not uncommon because of some of the hormonal changes and anatomical physiological things that occur with men, it's not uncommon for them to also have enlarged prostates, which can also cause some other issues related to urination as well.
Well, we all go through it, whether we are male or female, as we get older. So thank you for sharing about the specifics of each one of those. So let's talk about perimenopause. There seems to be a lot of conversation here lately in younger women, probably a little younger than us, in experiencing perimenopause. I think some of it is generational, where we get to the point where we didn't talk about certain things. And now we're to the point where, yes, we're going to talk about this so that everybody gets the information. And so that's what this platform is about tonight. Tell us a little bit about perimenopause, when it begins and what we can expect, and who should know about it first.
Yes, so perimenopause begins between the ages of 35 to 45. There are some women who will begin it a little earlier, and there can be hormonal factors, lifestyle factors that dictate that. But generally speaking, between the ages of 35 and 45. Now, if you are 35, I'm not saying that you're entering the perimenopause right this moment, okay? But somewhere within that age range is when you start noticing women having higher levels of estrogens that have decreased itself, when they start noticing that fertility is declining, ovulation is not as consistent. They start having other symptoms such as hot flashes, some of what some people may call like the mood swings, increased anxiety, brain fog. Those different symptoms can actually occur in perimenopause. And perimenopause, with being that bridge to menopause, this is your body's preparation for your for it to complete the transition of your menstrual cycle ceasing. However, all those symptoms I just mentioned do not have to be your reality. Okay, it does not have to be your reality. And I do want to kind of take a moment to go back as well. If
Sure.
you were someone in your early 30s and you were experiencing some of the symptoms that I just mentioned, I encourage you to reach out to your gynecologist, reach out to an endocrinologist, so that way you can undergo necessary testing just to see where your ovarian reserve is, because our ovarian reserve does decrease tremendously in our 30s compared to where it was in our 20s. However, anyone who actually enters into menopause before the ages of like 35, that is concerning. So we want to at least know what is going on with your body, where you are, because it can have significant health impacts for you long term. So if you're noticing that, hey, my cycle's inconsistent, let's get to the bottom of it. It may not be perimenopause, but it may. Either way, your cycle is a vital sign. So if you're still within your fertile window, we want to make sure that you're tracking your vital sign, your cycle, and that you also are that you know what is normal and abnormal with that as well.
I'm glad you mentioned that. There's not a specific test, is there, to determine if you're in perimenopause?
No, so there's no specific test to determine whether or not you're in perimenopause. However, some providers will actually test for your AMH levels, which can give you more information about your ovarian reserve and let you know where you sit as far as fertility goes. So if your ovarian reserve is much lower based upon what it should be for your age, then we know that fertility has declined, and that could be indicative of perimenopause. We cannot say definitively, but it could be indicative that you are entering into perimenopause and potentially nearing the menopause as well. But even with that, our hormones shift so much throughout the month in itself. So because our hormones are constantly fluctuating, even on a day-to-day basis, we don't have one definitive test, because they can test you one day for your hormone levels and it'd be completely different when they test you just in a couple of days. So right now there's no specific testing. And even when it comes to testing hormone levels for both men and women, we have normative values, but the range is so wide to where it really does not take in consideration as far as a woman or a man as an individual. Specifically with women, when it comes to perimenopause, we forget that we're individuals. So your levels may be low for you, but maybe someone else is average. So we don't have a definitive test as of yet.
Gotcha. Okay. So the AMH levels and checking your ovarian reserve is important for knowing kind of where you stand. Yes. In terms of your fertility and the details of your cycle. So That's good to know. And we should consider perimenopause between 35 and 45. Am I right?
Yes. Yep. Perimenopause range 35 to 45. That's the range where it starts. So that is the average.
So it could be before or a little after that in terms of you, because everyone is an individual. Okay. So let's talk a little bit about menopause.
Mm-hmm. So with menopause, you already heard me say, if you haven't had a period in 12 months, congratulations, you have gone through menopause and now you are postmenopausal. And the reason why I say congratulations is because we should really consider these the golden years, and not golden years like you think of the Golden Girls, okay? However, they were living their best life. And this is your chance to be able to continue to do the same with the proper support. But in menopause, we do know with the decrease that women have had as far as the estrogen levels, estrogen is protective for us when it comes to knowing more about our bones, knowing about our muscles, knowing about our heart health, our muscles, our joints, all those different things. So in menopause, if your body's not prepared, then you may notice all of a sudden that your blood pressure is running a bit higher. You may notice that your glucose levels are a bit higher. It may spike even easier. You may notice that your weight hasn't changed, but now you have more belly fat. And that weight change, the weight's not changing, but having more belly fat is simply because now the fat is replacing muscle. So you're losing muscle mass and you're developing more visceral fat. You also may notice in menopause that, hey, I'm running hot. Why do I feel hot? Why do I wake up in a sweat? Why do I feel like I can't remember these different things? But even though I've said all of that, remember these are your golden years. So it does not have to be that way. There are different things that you can do when it comes to lifestyle, making sure on your side that you're getting enough sleep, 7 to 9 hours of sleep, of quality sleep, entering into deep sleep. So that way you can actually have the time for your body to rest and recover. Making sure you're getting plenty of fiber. I know there's a huge focus right now on protein, especially protein with women. And honestly, a lot of people get more protein than what they actually need, but they don't get enough fiber. And we know the benefits of fiber when it comes to protecting our heart health, protecting our gut health, when it comes to helping our entire body just function more optimally. So getting more fiber can be crucial. Stress management. And I don't know about y'all, but most women are stressed. I know sometimes I'm stressed, but we have to take in consideration as to how stress impacts us, because stress in itself is not only taking some of your mental bandwidth, it's taking a physical toll on your body. So you have to find techniques and things that you can do to manage your stress. And if you're not already lifting, I need for you to start lifting. Everyone wants to do more cardio. Cardio is great. It is great. It does have a purpose, but you have to lift, because guess what's not going to help you stand up out of a chair? Your cardio. But you practicing squats, guess what standing out of a chair is? It's you doing squats. So you want to make sure that you're practicing and taking the time to do resistance training. So that way you can carry your own groceries inside your house. That way you can go up and down the stairs. So there's so much to understanding menopause. When we address our health as a whole, we can help impact the other symptoms that are associated with menopause as well.
Exactly. I'm glad you mentioned these things, because you already kind of answered this next question, which is, why are we talking about it as physical therapists? There are so many health professionals that this probably fits in line with. And those who are watching, maybe you are wondering, why are physical therapists talking about it? But you mentioned a lot of the reasons, because we encounter it in so many ways, because we're dealing with the whole body, and the whole body is not just your muscles and your nerves, all the things inside that make you up as well. But if you want to expound on the physical therapy perspective, please do.
Yeah, so I'm a physical therapist, and one area that I specialize in is pelvic health. So whenever people hear women's health, they automatically assume that it is limited to pelvic health, and it is not. But I will first at least address some of the pelvic health concerns that we tend to see when it comes to menopause. And when it comes to menopause, we know that women are at higher risk of prolapse during this time because our ligaments itself are not as strong.
What's prolapse?
Prolapse, yes, thank you. No, so pelvic organ prolapse is you have with the pelvic floor muscles, those muscles help to support some main structures within women, and they support our rectum, so where stool and feces come out. It supports our uterus, which houses the baby, and also supports our bladder. At times when the pelvic floor becomes weak, and also when some of the ligaments become weak, these structures can start to drop down. And women may notice that they're having pressure within the vaginal region. And sometimes they may even look down and they may even see like a visible bulge coming out of the vagina or in the vulva region. And that even without the bulge, just having that pressure can be indicative that you have a prolapse. And so those are things that as physical therapists, we help to address as far as muscle strengthening. Yes, Kegels are great, but they're not the only answer. We also can help fit you for pessary, so that way you can get immediate relief, especially depending on the severity. A pessary is like a little sports bra, if you can imagine, but it's made to put inside. So they come in different shapes, different sizes, just like sports bras do for the breast. But a pessary actually goes inside the vaginal region to help lift and support those structures. So that way you're not having those nuances and those symptoms. When it also comes to pelvic floor, incontinence is common, not normal. I'm going to say that again. Incontinence is common, not normal. Okay. So yes, they tell you, oh, honey, you just had a baby. No. Oh, honey, you're going through menopause. Got it. It may be a common thing, but I don't ever want you to think it is normal. So that's something that we address as physical therapists. And then also, even when it comes to outside of the pelvic region, those are two of the main things. But yes, we'll focus on like the surgeries that can occur with associated menopause and postmenopausal. But outside of the pelvic region, we help to address breast health. So that way, sometimes even something as simple as your bra not fitting properly, because bra sizes can change. That can impact your breast health. That can impact your back pain. That can impact overall how you are functioning, simply because you have an ill-fitting bra, or simply because now you have breast tissue that has not been supported over a long period of time. And now you're like, why do I have pain in my axillary or my armpit region? We help with lower back pain and hip pain and those shoulder pain issues, because rotator cuff is a very common thing to see with women when they go through menopause. Very common issue for them to have rotator cuff tears or rotator cuff tendinopathies. And same thing, everyone is diagnosed all of a sudden in perimenopause and menopause with having greater trochanteric bursitis. We actually look at it and actually screen them. This is more of a muscle tendinopathy involving your glute med muscle. So we can help address all those different things. Even foot pain, plantar fasciitis runs rampant in menopausal women. So across the board, from head to toe, we can address it all.
Why does plantar fasciitis run often in older adult women?
Yes. So plantar fasciitis and some of the other tendinopathies I mentioned, that is more common because of the decrease in estrogen. So estrogen has a protective factor when it comes to our ligaments, when it comes to our tendons. It helps to allow for elasticity, so that way they can kind of move and groove, bounce back a little bit easier. And as we age, we start losing some of that flexibility. One, because we're not moving as much, just being honest, we're not moving as much as what we should. But then also, yes, there is a hormonal component, but we can help combat the hormonal component by moving more and by making sure that we're taking time to wear properly fitted shoes, making sure that we're taking time to do strengthening activities as well. So plantar fasciitis and tendinopathies, they run rampant in menopause simply because of the estrogen decrease, but we can do our role to help with it as well.
Sounds good. I think there are a lot of issues that we tend to find in this age range, but we're not attributing it to this cause. Like we'll go to the doctor and find out, okay, they're not finding a reason. Possibly they're not testing for a specific thing that we know it is. However, the person is still having the same issue. And I think it's important that we iterate to you tonight that physical therapists can help with any movement issue. So if it's any of the ones that she listed, any of these other things, whether you are someone who has just experienced an injury, anything like that, it's important to see a physical therapist because we really are the movement experts.
Yes.
So we have a couple of comments. I'll let them show, and then there's some questions here. Thank you for watching. And thank you for watching too. Let's see. Okay, so we have a question here. It says, anything that can happen to minimize perimenopause? You touched on it a little bit.
Yeah.
Let's move into it.
Yeah, so some of the lifestyle techniques that I mentioned, sleep, stress management, those are important. Diet is important. So we do know that as a whole, that tends to be a better diet as a whole. Now, the Mediterranean diet, so we know that tends to be a better diet. So the Mediterranean diet is on whole, I'm going to say it again, whole fruits and vegetables, whole grains. And then it incorporates more fish compared to other meats with the Mediterranean diet. And so that way we can make sure that we have the proper balance of the nutrients that we need. Yes, supplements can be helpful. I tend to tell people to lean towards getting the nutrition that they need from their food and then adding in supplements where they're lacking. But when it comes to supplements, the more people want to explore that, that's when I refer them to a dietitian, because sometimes they're putting extra things in their body they don't need. And at least that way we can get them lab work and get someone who specializes strictly in dietetics to guide them. Right. But even then, when it comes to especially like a common symptom with menopause with brain fog and also muscle mass decreases, creatinine can help. I'm sorry, not creatinine, forgive me. Creatine can help. Creatinine is a different measurement, forgive me. But no, creatine can help. So we know that it can help with brain fog. We know that it has a direct impact on the frontal lobe when it comes to execution and also comes to planning. We know that it has a direct impact when with the muscles responding as well. The biggest and most important thing with that is making sure you're getting enough water. And most people in general don't drink enough water. What's and the question I always get is how much is enough? Will you get ready to ask me that?
Yes, you know it.
So that's a trick question, because we generally say, yes, you've heard people say, I need 8 cups of water a day. That might be a good place to start for some, but it may be too much for some and not enough for others. Right. So if you look at your body weight and you take half your body weight in fluid ounces, that may offer you a better place to start. But there's some caveats that go along with that. You have to consider your body composition. So when it comes to fat versus muscle, we know that people who are with more muscle mass may need more water. So be mindful of that. When it comes to the environment that you're in, if you're in a climate that is more dry, you may need more water. If you're someone who's exercising a lot, you're going to need more water. So generally speaking, when it comes to seeing if you're getting enough water, I tell people, look at your urine. If you look at your urine and your urine is a light pale yellow color, then you know that you're well hydrated. You also should have to pee somewhere between 4 to 5 times during the day, not going every single hour. That's a different issue. But also you shouldn't have long breaks where you're going 6 to 8 hours in between. So during the day, somewhere between like 4 to 5 times, maybe even a little bit more if you're drinking more water. So just be mindful. You can look at your urine to tell you whether or not you're hydrated. You can also look at your skin. You can do a simple pinch test where you just take your fingers and pinch the skin. If the skin pops back down like mine is here, then you're well hydrated. But the skin stays pinched up after you let go, that's a cue to your body that you're dehydrated. So Be mindful. Your body is telling you what it needs. If you get frequent headaches, start off with drinking more water.
Yeah. Very good. Very good.
And then I did not mention this with perimenopause, so I went off on my lifestyle tangent, but hormonal replacement therapy is a valid option for a lot of women. I want to make sure I emphasize that, because this is something that's thankfully gaining more traction. So hormone replacement therapy is pretty much where you're using hormones such as estrogen, progesterone, and also sometimes testosterone as well, to help regulate and manage some of these symptoms. So you're working directly with the endocrinologist, gynecologist, and even sometimes different functional medicine providers as well. So that way you can get a good fit for you, because it's not one size fits all. They may try some different things so that way you can figure out what works best for you. And it can come in the form of like a topical cream, a patch, some type of oral pill. So there are different ways that you can receive hormone replacement therapy, and it is safe for most people to take. I'm going to say that it is safe for most people to take. So if someone tells you that, you're not a candidate for hormone replacement therapy, make sure they're giving you a real reason versus them giving you their personal opinion, because research right now is supporting the use of it as far as, helping to manage pain, helping to manage hot flashes, helping to improve anxiety, helping to manage brain fog, various different symptoms related to perimenopause and menopause.
Hormone replacement therapy, and you should check with your gynecologist or your
endocrinologist. Yes.
Okay. And then is this something for men as well or just females?
So with men as well, what they'll typically do is they may supplement with testosterone. And one of the most common forms with that is either like in a topical cream form or even like with pellets. So that is usually what they do for men. And yes, testosterone is not just for men. It can be for women as well, because it can improve libido. It also can improve motivation and as far as a drive to participate and do other activities as well. So testosterone is not just a male hormone. Ladies, your body naturally makes testosterone. It's just that men make more.
Yeah, exactly. Okay, here's another question. Do men experience any menopausal symptoms? We addressed it as andropause. But if
Yes.
you want to expound.
Yeah, so with andropause itself, generally with men, they will express symptoms of decreased libido. So that's decreased interest in their desire with intercourse. They'll express sometimes that they may have erectile dysfunction. And whenever men do have erectile dysfunction, one thing that I always look at is their blood pressure, because heart health is so important. When it comes to erections, is based upon blood flow. So if your blood pressure is high, then blood flow may be impacted to the genital region as well. With men, with motivation in general can be impacted. So sometimes they may say that they just don't feel the same motivation or drive they typically had before to participate in different activities. Muscle mass in men is impacted. Their muscle mass loss typically does not occur until they around early 50s, around the age of 55, usually at the max. And that's when they start noticing more a decrease in their muscle mass. And also with men, yes, they can experience the insomnia that can occur with the hormonal changes as well, along with prostate changes.
Let's talk about decrease in muscle mass. How will you know for the layperson that you have a decrease in muscle mass?
Well, one thing you can do is look in the mirror. And you can honestly look in the mirror and you can see what your muscles look like. So look back at previous pictures. Also look at the scale, because even though the scale may not change, but your pictures look different, that's the indication that you've lost muscle mass and probably have gained more adipose tissue, so more fat tissue. So take a looking at pictures so that way you know. And even then, if you're someone who is getting out of a chair and you're no longer able to stand up out of a chair with simply using your legs, now you have to use your arms, you're losing muscle mass. If you're someone who is having a hard time now pushing open that door, your body doesn't have the strength it used to have because you've lost muscle mass. Getting on and off the floor. So take note as to how you're doing certain activities, and don't just, account it to, oh, I'm getting older. That's why these changes are occurring. Yes, you are getting older, but what can you do to help combat those changes? So yes, if normal activities for you have become more challenging, let's take a look at muscle mass. And there are different things that we can do when it comes to actually testing body composition, where we can test your fat composition. So that way you'll have an idea as to what percentage of your body is fat. One of the most accurate methods is bioimpedance. And that is more so something that you see like in a specialized clinic where you either stand on a device or you hold a device and they send like a current through your body. Another one that you can do, very, very simple, that most clinicians should be able to do. I know physical therapists can, because I teach physical therapy students how to do this. It's the caliper test. For men and women, we test on different areas of the body where you are simply taking calibers, which is something that's just going to gently pinch the skin. And you are measuring, for instance, like at the back of the top of the arm, you're measuring at the lower abdominal region on the thigh itself to see how much of that tissue is able to be compressed, because that gives you an idea as to how much fat tissue is present. And the higher the percentage for fat tissue, more than likely, the lower the percentage for muscle mass. So those are some different clinical ways you can tell if you can't look in the mirror or if you can't even notice your changes with getting in and out of a chair.
Absolutely. I like all those examples. I agree. Okay, here's one. Let's go through a couple of comments. Okay. Do men have estrogen?
Yes, they do, but it's lower amounts. So both men and so that's why, we were always taught that estrogen is the female hormone and testosterone is the male hormone. And what we really need to say is that women are estrogen dominant, men are testosterone dominant. Because ladies, I'm not to shock you, you actually make more testosterone than you do estrogen, but men typically make about 10 times more testosterone than what we do. So yes, both genders have estrogen and testosterone. It's just as far as which one is more dominant.
And so to that point, we have older adults, and as we get older, hair grows in different places. And it can become a thing for us to try to take it away. But it shows in different areas. Why is it when we are older, we experience more of the testosterone type features where we have hair in places that men have?
Yes. So our testosterone levels do change as we get older. They do decrease. but our estrogen levels change significantly more. And that's not just as we get older. So there are also some younger women who may be listening to this who may have more testosterone in general. And there are different hormonal based conditions that may contribute to that, such as polycystic ovarian syndrome, PCOS. And then other times they just may have an imbalance without someone having the true diagnosis. So when testosterone levels are higher compared to that of our estrogen levels, then we'll start noticing, you know, like the male pattern balding, like in the front. We'll start noticing sometimes you'll hear women say, especially in menopause, they're like, why do I feel like I'm 15 again and I have acne? Yeah. And it's because of the hormonal changes. Estrogen has decreased. Testosterone now, the balance between them, testosterone seems higher because estrogen has decreased. Now the chin hairs, you know, sometimes you see people joking. They're like, you know, every morning I have to wake up and pluck my chin hairs because we have that imbalance. So you may start noticing more of the male-based patterns of growth and also hair loss in certain areas as well, more consistent with male-based.
Very good and very informative. Thank you for watching. Thank you for watching too. If you have a question or comment that we have not answered and you want to have it answered before we get off today, we want you to put it in the comment. Pull up with Limbs and Things is to confirm something you know, challenge something you don't know, and give you the opportunity to share this information with someone else. Dr. Dionne, is there anything that you haven't said that you really want to make sure that everybody knows in terms of perimenopause, menopause, or andropause?
Yes. So for all of them, first, both for men and women, the things that we do in our youth impact us when we're older. So even though, you know, those joining us, I know myself, I'm no longer in my 20s, I'm in my late 30s now, but there's still things that I can do to help combat changes. But even then, if you know someone who's in their 20s, even have the conversation with your kids. Let them know, hey, let's go ahead and make sure that we teach and educate the importance of a healthy lifestyle to better set them up and better prepare them. Because we're noticing a lot of fertility changes for both men and women, which is going to cause an earlier onset for some of these things such as perimenopause, menopause, and also andropause. Is going to cause an earlier onset if we continue to have all these different hormonal and endocrine disruptors that we're not addressing. And a lot of them we can address. I understand we can't always change our environment, but we can adjust how we sleep. We can address how we eat. We can address our physical activity to better prepare our bodies for when we're 80. Because jokingly on social media, someone asked me, what are you training for? One, I'm training so that when my kids beat me in a foot race, they will have known that they've earned it. And then two, I'm also training so that way, you know, 50, 60-year-old Dionne is still able to be able to run and jump. That way, when I have grandkids, I'm able to get on and off the floor with them. And I'm not feeling fragile, because we tend to think that our elders are fragile and that they're feeble and that they're weak when they may not have been afforded the same opportunity or same knowledge. So now that we have the knowledge, let's pour into them and pour into the younger generation so we can all be better prepared to make these different transitions that occur, because this is a natural part of life. It is a wonderful part of life, and we want to make sure we embrace it by just simply preparing.
Absolutely. So let somebody else know who's younger than you. Is that a good summary?
Yes, it is.
So tell me, I just have a question in terms of those who have had children, those who have not. Is there a difference in terms of going through each of these phases?
So right now, to my knowledge, based upon the research, there is not a difference. We're going through the phases. We do, however, notice that with certain health risks, when it comes to increased risk of stroke, heart attack, those different things, that women who have breastfed in the past, that they tend to have more protective factors when navigating some of those risk factors. So that is something that we do know when it comes to pregnancy, specifically related to breastfeeding. So breastfeeding is important for both mom and baby, not just baby.
Right.
When it comes to men, that one I do not have much knowledge of as far as whether or not it impacts their ability as far as how they transition. But we do know that generally speaking, men remain fertile much longer. So if fertility in men is impacted at an earlier age, then we need to get to the underlying reason as to what's causing the endocrine disruptors for them, because that is definitely something that we do not see with men. Because women, we lose our fertility earlier. Men, we know they remain fertile. They're able to usually produce sperm much longer compared to women, even if the sperm itself may not be vital. So they're usually able to still produce much longer.
Right. Okay. I know we answered this, but if you don't mind. So it's perimenopause before full-blown menopause?
Yes, perimenopause is the bridge to menopause. So the perimenopausal phase can occur somewhere between 7 to 10 years before you actually go through menopause. The average onset of perimenopause is between the ages of 35 to 45. So that's a 10-year gap, and that's just the average onset. Most women would have gone through menopause by the age of about 55, so early mid 50s. With menopause, menopause is when you have gone without menstruation for 12 months. You also can undergo immediate menopause following a surgical procedure. Now, with that being said, if you have gone through menopause and you have not had a period in 12 months, and I'm bringing this up because it just came to my mind, I've had someone 65 before tell me, oh, I'm noticing bleeding. That is not normal, and that warrants an immediate visit to your provider, because once you stop your menstrual cycle, you should not restart vaginal-based bleeding. That is a concern for something else, potentially cancer. So please make sure that if you know someone, share that information.
Absolutely. Speaking of the men who experience perimenopause with their significant others, do you have any advice for them?
Be gracious and be mindful. She's going through a transition that she may not fully understand, that she may not have received education on. And this is a time where you can gracefully help and assist, where you can gracefully, and also make sure you know your partner's personality as well as to how you should best approach them. Mm-hmm. Because a lot of times it is very frustrating when you are used to functioning at your best, and all of a sudden now you can't remember where you put your keys. That can be very frustrating. And it's not always a sign of dementia. Sometimes it's simply just a lot is going on, the hormonal transitions. So what can you do to help and support? Can you have the conversation as far as, hey, God, I noticed that you're having hot flashes. I'm noticing that you're saying this. I'm noticing that, you're saying that you're unhappy with some of the body changes. What routines can you help implement as her support partner? So that way now you all can do together. So resistance training can help with hot flashes. Are you able to motivate her to do resistance training with you? I'm not at all telling you to load the rack up and make her do 800 squats, but gradually introduce her to it. Yeah. Are you able to, and make an environment where she's able to sleep better? Say, hey, honey, maybe you should put your phone down. We're probably going to be heading to bed in the next hour, and we know that you're going to sleep better if you don't have that blue light exposure right before you go to bed. Mm-hmm. So giving them grace, and also looking for different ways that you can help support them by you initiating some of those routine changes.
Awesome advice. Okay. How can patients convince providers to test for PCOS or other peri or menopausal symptoms?
So with PCOS itself, there is not one definitive test. Generally speaking, with PCOS, women are diagnosed when they fall into, when they have certain symptoms and they check certain boxes. Mm-hmm. PCOS is a syndrome. So we currently do not have one test just to say, yes, you have it. But if women are noticing that they have irregular cycles, irregular menstruation, if they're noticing that they have a hair growth in a male pattern, hair loss in a male pattern, acne, the skin changes. Sometimes you may notice also as well that with the women that they have higher levels of glucose, so they are insulin resistant. Those are generally signs that a woman may have PCOS, and they will test for, and they will actually diagnose based upon that criteria. You do not need the criteria as far as them doing an ultrasound of the ovaries, where they actually see what they call the pearl necklace, which is pretty much follicles that have, like, if you can imagine, like little bubbles that appear on an ultrasound, and you will have several. We no longer use that as the strict diagnosis for PCOS. So it is possible for someone not to have any of those cysts, as they will call them, or those follicles on an ultrasound, but to check off all the other boxes. And then at that point, for them to receive the diagnosis of PCOS. So if you're noticing those symptoms, bring them up to your provider. If you're not having a period, your period should be occurring roughly every month, and it should happen within 2 to 4 days of the previous period. So let's say most people are not the typical 28-day, but let's say, you're someone who have had their period 31 days, and the next month it comes at 33. That's what I would expect. But if you're someone who has their period, 31 days, and then all of a sudden it's been 62, that's too long. Let's figure out what's going on. And if you're not having a cycle as you should, speak with your provider, because your cycle is a vital sign. It's not always PCOS. Sometimes it's that we're not getting the proper fuel or nutrition for our bodies. Sometimes we may have Of course, with birth control, that can impact as well. But even other times, it can be stress. It can be lack of sleep. Other factors can impact your menstrual cycle. So if you're not having a normal menstrual cycle, that's step one into you figuring out what the cause of it is. So having a conversation with your provider. And then I know someone also mentioned like advocating. Sometimes advocating means that you have to find a new provider. And that's just what it is. If your provider's not listening to you, sometimes you have to go find someone else who will listen to you. Just remember that when it comes to healthcare in our country, as the patient, you are the customer, and the customer has the right to choose who they see. In most cases, of course, some government-based insurances, that is different, but in most cases, you do have the right to choose who you see.
You answered this next question. How can someone advocate for themselves if they're being dismissed at the doctor? Yeah, absolutely find another provider. Okay, I think this was informative, and I think it has helped us a great deal to know the difference between the two. If you have a question, and I see one. Okay, I'm going to show it in just a moment. Okay, how can the patient help with menopause and hypothyroidism?
Is that how can patient or how can PT? I want to make sure I get it.
Yeah. Can you clarify for us? Maybe it's PT. Okay.
Yeah. So first thing I want to say when it comes to this is that I cannot prescribe you medications to battle or combat menopause or hypothyroidism. But what I can do is I can help treat some of the symptoms that go along with it and also help develop a regimen that works for you. Generally speaking, with hypothyroidism, we know that weight can be a concern. So we can definitely help with the weight management aspect. We can definitely help with you improving some of your lab values through proper nutrition, through exercise, and getting you on a proper exercise prescription and regimen. So that's one aspect where we can help. Also, when it comes to hyperthyroidism and menopause, we know that both of those are going to impact your muscle mass and your bone density. That is where we come into play. That is our goal when it comes to being a preventative and also rehabilitative-based provider if you've already been someone who's already experiencing or suffering from those symptoms. So we can help you to improve your bone density and muscle mass to get you started with that. Sometimes with my patients, well, I'm not going to change that. I'm actually going to say a lot of times with my patients, I'm the person who's referring them to who they need to see. Because they'll come to me with all these symptoms that everyone else has ignored. And as the physical therapist, I'm the one putting all the pieces together. And then at that point, I'm making the referral saying, here's what I can do, but here's also how you would benefit. And let's talk with this provider to see if hormone replacement therapy is something beneficial for you. When it comes to the thyroid issues, thyroid medications at that point are going to be lifelong, but make sure that you have an endocrinologist that understands how it impacts other systems as well to see if we need to adjust those medications.
Very good advice. Very good advice. I hope that has answered your questions. Thank you all so much for joining us. Dr. Dionne, do you have a final thought you want to give us, and how can we connect with you?
Yes. So my final thought is, someone put it in the chat, and I'm going to say it again. Your menstrual cycle, your period, is a vital sign. So whether or not you are just now starting menstruation, whether or not you have been menstruating for years, you're going through perimenopause, or even if you've already gone through menopause, your period is a vital sign. So of course, through menopause, you're not going to have that period, but share that information with someone else, because we want to make sure that we can do everything we can to protect and also help to better prepare the next generation. That is always the goal with education, to make sure the next generation is better prepared than what we were. So if you want to reach out to me, I can be reached on several different platforms, but the easiest one probably would be Instagram, and I can be found at Reign, spelled REIGN, pt.wellness. So that's probably the easiest one, but I have that. I have my TikTok, because everyone has to do TikTok nowadays. And then I also have the Facebook page and my YouTube page.
Yes, and Dr. Dionne is in Georgia. Tell us where you are in Georgia. You have a physical location now. Congratulations.
I do. Yes, I do. So I am based out of the Metro Atlanta area. I service a large portion of the south side of Atlanta. So specifically my new office, my new clinic, we just opened up. We just had our first patients in the new clinic in McDonough, Georgia. And that was yesterday where we just had our first patients in clinic. Prior to then, for the past 3 years, I have been strictly mobile, but I will be continuing my mobile services as well, in addition to in-office, because there is a huge need for mobile. So I do cover a large portion of the South region of Atlanta in the metropolitan area.
Awesome. Okay, there was one more comment. How to decrease stress. What is your advice?
Yes. So first and foremost, figure out what you can take off your plate. Because everything that's on your plate is not something that needs to be there. That's the first thing. And then don't, forget about basic things such as breathing. We have amazing research that indicates that proper breathing supports your nervous system. And if you learn how to breathe to calm your nervous system, then you're able to help decrease stress with that. Simply breathing for 5 minutes, even finding like a dark space where you're able to kind of reset can be very helpful. So when it comes to breathing, since you brought it up, we're going to talk about it really quickly. Most people don't know how to breathe, and we have to teach them how to breathe because everyone takes a breath like this. I'm sure you've seen it.
Oh, yeah.
And when you take a deep breath, if you're taking a breath like that, you're not properly using your diaphragm. You're not going to get the full benefit. So you want to make sure that you get true expansion of your tummy. So when you inhale, your tummy should actually move out a little bit. Your ribs should actually move out as well. And then when you exhale, things should go back down. But taking time to do slow, deep breathing. And we even know that when we extend the period of time where we're exhaling, so if you take a breath in, and you're inhaling for about 2 to 3 seconds, and then you exhale for a longer period of time, let's say 5 to 6 seconds, we know that that can directly impact your parasympathetic nervous system and allow for your body to calm as well. So breathing, don't discount it. But first thing I tell everyone is figure out what you can take off your plate. Because a lot of times we're trying to juggle too much and we're just trying to be Superman or Superwoman. And it's not the best thing for us. So figure out what you can take off your plate, incorporate breathing, go outside. You need vitamin D. Vitamin D from a supplement is great if you need it, but the best way to get it is from the sunlight. And we have a lot of research that supports that being outside in the sun, in greenery, in nature, can help to decrease and improve stress levels, can help to improve mood as well.
Yes, and we have to take away some of our excuses. It's cold. I don't want to go outside, all of those things, but it's definitely important that you get out. It'll boost your mood too.
Yes, it will.
Well, I'm so glad to have you. Happy New Year and congratulations on all of the things that you are doing. I'm so proud of you.
Thank you. Thank you for the continued support. It has been an amazing journey. It really has.
Absolutely. Well, if you want to contact Dr. Dionne, her information is here. She's in McDonough, Georgia. If you want to see her in person or have mobile therapy, she is a pelvic health provider, but she's also a physical therapist, and we all can treat the whole body. So if you need us, you can also contact LimbsNThings if you are in need of physical therapy services. We serve aging adults in DC, in Maryland, and in Virginia. Our goal is to help you move from whatever you can't do to being able to do it. This is Pull Up with LimbsNThings. Happy New Year. I am so excited to be here with you guys tonight. Have a good night.
Good night. Happy New Year.
Take care.